welcome everyone. Allie, thanks for going in person. Thanks everyone for being there. I call to order the April 20th, 2021 LaPorte County Board of Health meeting. Roll call, please, Julie.
Certainly. Ms. Lawn?
Here.
Dr. Manning Cox? Mrs. Arnold? Lauren?
Here.
Here. Oh.
Okay. Dr. Dora? Dr. Nelson?
Can't hear you.
I can't hear you.
Dr.
Yeah, put the mic
Uhas?
closer, Julie.
Okay, Dr. Uhas?
Present.
Mr. Sandy?
Here.
Okay. We are done. Thank you.
All right, thank you very much. Next item on the agenda is the approval of the minutes from January 19th, 2021. Does
Make a
any,
motion, we accept them.
let me finish, Mike. Does anyone
Sorry.
have any questions or comments about the minutes from January? If not, I will entertain a motion to accept it. Hearing none, is there a motion to accept the minutes?
I so move. Mike.
Second, anyone?
I'll second.
Second.
All right. All in favor, say aye.
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 Is there anyone opposed? Hearing none, the approval of the minutes from January 19th, 2021 has gone through. Next item, selection of legal counsel. Last meeting in January, that selection process was tabled. Just to bring everyone up to date, we did meet once as a search committee. We discussed the issue and decided that at this time, changing law firms in the middle of a pandemic with ever-changing directives and ever-changing numbers about the COVID, that we wanted to make sure that nothing got lost and fell in the cracks as far as all of the ordinances and mandates and rules and regulations. And so it was unanimous, bipartisan search committee that we would suspend the active search. If anybody stepped forward and showed interest in that position, we would consider it. But as it turns out, we are prepared to make a decision today to accept Shaw, Friedman and Associates as the legal counsel for the LaPorte County Board of Health. Is there any discussion for that? If not, then I will entertain a motion to name them and to approve it. So is anybody ready to make a motion to approve the continued services and adequate, very good services of Shaw, Friedman and Associates representing the Board of Health? Is there a motion?
I would like to make a motion that we retain Shaw, Friedman and Associates as our legal counsel.
Is there a second?
Second.
Who I can't see who that was.
Oh, it's Georgetta.
Hi, Doctor. Welcome.
Hi, how are you?
I'm great. All right. So, all in favor of accepting Shaw, Friedman and Associates and retaining them as our legal counsel, please say aye.
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 Aye. Anyone opposed? The ayes have it. Mr. Picardo, you guys are ready and willing to continue on as our law firm?
Yes, of course, Doctor. Thank you for the vote of confidence, and we will continue to work with you all and happy to help.
Thank you, sir. Appreciate it. All right, moving on. Public comment. Is there any public comment? Going once. Is there any public comment twice?
Doctor?
Yeah. Yes, who's speaking?
This is Councilman Mike Mullenhour, and I just wanted to mention the fact that, and tell Amanda my appreciation for, she attended a club meeting back in March and spoke on the COVID situation and gave us an update on the vaccine program and the plans in the future in that. And just wanted to let her know that myself and the club members were very much appreciative of that. And Julie set it up, and thank you, Julie, also. So that's all I have. Thank you.
Excellent. Thank you, Amanda, for doing that. All right, and public comment going for the third
Dr.
time.
Dr.
Yes.
Uhas,
Yes.
this is Sheila Matthias.
Yes, Commissioner.
I had a couple of things. First of all, I'm glad to be here and I'm glad to see all of you. The group that has been formed through the LaPorte County Board of Tourism, which includes Mike Mollenauer and a couple others that are on the call. Amanda's been present. We have been working on a media campaign, basically focusing on social media in particular, to reach out to folks around the vaccine and making sure that the vaccine, there's really good PR. We have a Spanish video, for example, that has had, it's a physician from LaPorte Hospital, and the video is in Spanish, and it's gotten tons and tons of hits. So, Amanda, if you don't have access to all of the documents that Seth was circulating after our meeting earlier today, I can share those with you. He sent a packet to me, and I just think the board members would find it really fascinating. And it would also be great if everyone circulated everything on their social media channels so that we can really try to make sure the message gets out that vaccines are important. And there's a video of Mayor Dermody, for example, so that we can show that all folks, regardless of race, creed, or color, need to take the vaccine. So I'll circulate that if Amanda does not, or if you need help with that, Amanda.
Thank you, Commissioner Matthias. You know, if Amanda and you could work together and get the board at least up to date on the links and that information, that would be great. That's good work. And what you're doing is you're doing service to work on hesitancy of people that are out there that we really need to get on board.
Yeah, one thing, I would be remiss if I didn't call out the Healthcare Foundation of LaPorte and Maria Fruth. She has spearheaded this effort and has provided the financial support for example, of the videos. And then we have a small company led by Seth Spencer, Sarah Solutions, who is doing all the technology, the filming, the marketing, making the arrangements with the physicians, the community leaders. And so they're doing a lot of it pro bono and as a community service to all of us. So just a shout out to them and make sure that the board was aware that that work was going on.
Excellent. And by the way, let me take this opportunity to welcome you as the liaison to the commissioners. So
Thanks so much.
Thank you for your interest, and we look forward to working with the commission. This is important. What the health department is doing, and support from the commissioners is vital. So thank you very much, and welcome.
Thank you. Appreciate it.
Sure, absolutely. All right. Any more public comments? These have been good. Any more public comments?
Yes, Dr. Uhas?
Yes, Mr. Haney. Commissioner Haney.
Thank you. Hey, I just wanted to take a moment to thank Director Lanners and to thank the board. She has made a excellent transition here over the past couple of months as former Director Mancuso left the picture, so she's done an amazing job, and the entire health department team underneath her has, as far as moving forward the vaccine clinic, keeping everything rolling there. It was just an absolutely seamless transition, and huge congratulations to her and to the board as well for everything you've been doing.
Thanks, Commissioner Haney. I have to say, everything I have heard in the community has been praise and rave reviews on the vaccination program. And people are very pleased with the way the health department's running it. And I really hope that with the Commissioner Matthias' efforts to get people that are hesitant, now that we're starting to make some progress nationwide, let's try to get LaPorte County really on board with the vaccine. It's just very important. Dr. Dora, hi. Did you have something? I see you on the screen. I don't know.
No, I'm fine.
Okay. All right. Arf. That was barking. It's a little dog joke there. All right. Are there any public comments from anyone? If not, I'm going to close that to the public and move on. And the health officer's report, please. Hello? Anyone? Is there anyone there?
Dr. Nisi, you're on mute.
Pardon?
How about now?
Yes.
Can you hear me now?
Yes.
Okay, sorry about that. So again, I just want to say how easy and incredible it's been to work with Amanda too, is that it really has been a very smooth transition for me. And the information that we share and can do it's been very good. Basically, a couple things is The biggest issue has been the masks, probably, and the fact that we are now in orange and are going to be in orange again as of tomorrow. And at this point, although I haven't seen all of tomorrow's numbers, we're the only county that's in orange. And obviously that's very disturbing for all of us that we seem to be the only one that can't do something about this as much as everybody is trying. Getting people to wear masks, whether there's a mandate or not, has been unbelievably difficult. People just are not doing what they're supposed to do, and to a certain extent, it's as simple as that. There's more to it than that, I believe. I mean, obviously, we have the variants around, which are affecting us. We border onto Michigan, which is having a terrible time, even worse than we are. And hopefully, some of these things will get back under control. The vaccination program at the fairgrounds is amazing. I've been out there myself just to see it, and I've had multiple of my own patients that have gone there, and as you say, there's absolutely nothing but congratulatory comments about it. The FEMA one that was the drive-thru at Rural King, I went out to that one too, and just to talk to some of the volunteers and the National Guard, and again, it was incredibly well run, and I was absolutely thrilled that that's being done in our county. Our biggest problem is right now, of course, is the vaccination hesitation, which is what you said at the beginning, Dr. Uhas, is that is an issue. And then, of course, because of Johnson & Johnson now being on pause, I think that's even added to it, although we were coming to that point, I think at some point. Anyways, more than 50% of Americans have had at least one vaccination. In the last number I saw, which was a couple of days ago, there's 24%, I believe, of the people of LaPorte County that are eligible. And this came out before the 16-year-olds were able to start getting the vaccination. There's 24% that were fully vaccinated, and then, of course, a lot more that have had at least one. So hopefully the whole issue with Johnson & Johnson is not going to contribute to the hesitation. And obviously, again, the more information that we get out and the more positive we can all be about doing this, I mean, you can't underestimate the importance of that. Johnson & Johnson, I believe, are hoping to have another statement out on Friday as to who, if anyone, is going to be getting these shots, and the thought is that it will probably be restricted to certain categories of people, but that has not been decided yet, so I honestly don't know. They feel that they've probably figured out why this is happening, but that doesn't mean it's going to be able to stop this from happening, despite the fact it's an incredibly rare complication, 7 out of over 7 million people. So hopefully that's not going to stop it, because the whole concept for the United States, but for a lot of the rest of the world that has even more complicated vaccination issues than we do, is having the one shot and then you're finished is obviously extremely important. Jenny's got the numbers more locally about our numbers, so I'm not going to repeat all that. I don't know how we get people to wear their masks. I get a lot of mail, trust me about this, from on both sides. And all I can do is just continue to say how important it is. I mean, the fact that we had no flu this year, and we had no flu because people were doing what they were supposed to do during the worst of the flu season. They were social distancing, they were washing their hands, they were wearing masks. But as soon as we hit blue, people seem to forget that we've still had issues. What Commissioner Matias was talking about, all the PSA that's going to be done in the near future, plus everything that is being done. Again, Tom Dermody's done a great job on his Facebook to do the amount of promo for the vaccines, and just generally, I thought that he's been very helpful. I see a lot of that. So I think that's my main thing. The bottom line is we're not doing well. We're the only orange county as of today. It may change tomorrow. I haven't seen all of them. And I'm very concerned, because if we go to red, schools, I'm going to assume, will be out again. And it's very disturbing. And if anybody's got any wonderful ideas of how to get people to pay attention to what they need to be paying attention to, I'd be absolutely thrilled to hear, as any of the rest of us would be too, I'm sure.
I have a question.
One more thing.
Sure.
Just one more thing too. And I'm retiring from my family practice as of May 27th. So fortunately or unfortunately, Amanda's going to see a whole lot more of me up at the county building once that's done. But that is coming along the line for me.
Good for you. Good for you. Wish you well.
I'll have
And
the coffee ready, Doctor.
I'm sorry,
I'm
what?
sorry?
I said I'll have the coffee ready.
Okay, got it. Thank you. And that was wonderful coffee this morning.
You guys are offering coffee and donuts over there? I didn't know that.
Did not need them.
Oh, no donuts. Well, then, I'm sorry. I'm tied up. But I had a couple of questions, Dr. Ducey. I know we're in that going up stage right now of numbers, but how are we doing with hospitalization numbers and death rates?
Hospitalizations have gone up. And I'm not sure, I think Jenny's got all those numbers, the exact ones.
Okay.
Divided this up so that I'll let her give you the exact numbers. You know, the death rate, though, has continued to be either stable or they just got better treatments. I mean, at the beginning, there was no treatment. I mean, that's why they think that some of the people that had the blood clots probably didn't do as well because nobody knew what to do with them. And the treatment that was given turns out to probably not be the best one. But, you know, the hospitals, the doctors, the ID guys, the infection intensivists have all come so far in the year in terms of the different treatments that they had. So the deaths are surprisingly doing well.
Well, that's good. Good. That's good. I mean, because of the medical treatment for COVID patients that are hospitalized, as you said, have drastically improved, got medications and immunoglobulins and convalescent plasma. Are we utilizing that in our county, or is that good? Because that's what I've heard on the television, continuing medical education, is that early stages hospitalization, get the convalescent plasma or the immunoglobulins and really cut the disease down.
I know they're doing it Franciscan, so I'm going to assume they're also doing it LaPorte, but I don't have actual knowledge of that.
And you know, the other thing may be too that, well, I don't know. If you got the vaccine and you got COVID, I always think you had COVID before the vaccine, and you didn't know it.
There was a article I was reading today, just in preparation for trying to keep up with this, and they said they just can't prove that. They just don't know. Because they were also, you know, the comment is that if you don't get much of an immune response to the vaccine, does that mean you've been exposed to it? But there's absolutely no way to really prove that at this point. So the assumption should be that everybody that has not had a positive test probably hasn't had it, but we know that's not true.
Right. Well, I think the best cure is prevention. If you can get the vaccine, wear a mask, don't get infected, don't get sick, get the vaccine, and avoid the other higher levels of medical care and risk for people.
Exactly.
We want our people to be hale and healthy a year from now when we have a meeting and everybody's here in LaPorte County that's here today, God willing. So, all right. Doctor, do you have anything else? I know I've been asking questions, but I don't want to steal your thunder here.
You know, I think that, I mean, truthfully, it's starting to sound like a broken record for some of these things, is wash your hands, you know, social distance, wear your mask, and you'd think by a year from now people would have got that message, but it still does not seem to be reaching everyone. So I'm just saying it again and again and again.
Yeah, I think that's all we can do is be consistent and hope that everybody feels the same way about pitching in, because it's really for themselves and for their friends in the community, their neighbors, people in the aisle at the grocery store that we come into contact with. We really need to pitch in and make sure people don't get sick. Anything else, Doctor?
I think that's it for me, unless there's any other questions.
All right, thank you. Do I have any are there any questions for Dr. Ducey? If not, then I will entertain a motion to accept her report. Hearing no questions, would anybody make a motion to accept the health officer?
We accept the report.
Is there a second?
I'll second that.
What? Who?
Either me or Dr. Dora, I think one or the other.
Okay. All right. All in favor?
Aye.
Anyone opposed? The ayes have it. All right. Moving on. Administrator Amanda.
Oh, that's me.
That's you. Yes, it is, boss.
Can you hear me now?
Okay,
Yes.
thank you. Good afternoon, and
Good afternoon.
welcome to first quarter meeting. I always find it odd that it's April and we're talking about the first quarter, and that's always very hard for me to go back and talk about January, February, March when we're in April and I'm trying to talk about now. But briefly, about the first quarter. We had 2 employees retire in the first quarter. Obviously, Mr. Tony Mancuso, who was with us for 17 years, and then we had a public health clerk that retired, Linda Feike, who was with us for 20 years. 20 years. I wasn't sure if it was 21. And we have had some plain internal musical chairs within the department. Obviously, I was selected as administrator into Tony's old position. We have a new environmental health and food supervisor, Mrs. Patricia Wozniak, or Tricia, who is new to the department. She's only been with us for 25 plus years. 31 years, excuse me. She's a newbie, so.
Welcome, Patricia. Thank you.
Yeah, so
Your
Tricia,
service.
we're very happy to have Tricia move into that position. Just she's a wealth of knowledge. She has a background. Well, she went to Purdue first of all, so that's a plus in her favor already. But has been instrumental in the food program and keeping us on the straight and narrow, keeping LaPorte County safe with that, and she is a wealth of knowledge where other people from around the state will call and ask for Tricia's guidance and input when it comes to food-related matters. So I'm very happy to have Tricia in that position. So that leaves us with a environmental health position that is currently being advertised, and we are on the search for a new inspector, as well as a open position with the public health clerk. Our testing site in Michigan City, the numbers are starting to pick up a little bit. January was low, but by February we picked up to 421 total tests for the month. March we saw 548, and the daily numbers have been a little bit higher this month, and I think we take that from people scheduling or people traveling during spring break, especially those who have traveled to areas where COVID is running rampant and those high variant counts. People are coming in and getting tested. So that is good. We're glad to see that. We will be operating, as far as we know, the state is going to continue to help supplement and fund that site, as well as the Optum site in the city of Michigan City through June, and after that it's basically month to month whether or not we're going to be able to keep that. But as they say, the state wants both of those sites and all of the testing sites up and running at full capacity, because it's easier if they start cutting back. As soon as you start cutting back, then you're going to have to increase testing capacity, and that's when it's going to go out the roof. So they want to keep those up and running and ready to take that influx if there is any. The vaccination site is going very well. We have, as of yesterday, we crossed the 22,000 shots given thresholds. So as yesterday, 22,227 shots, vaccinations given at our clinic at the fairgrounds. Which is the highest numbers out of any of the clinics in the county. And of course, we are doing Moderna at our clinic. We are having to vacate that space. We will be going to, I don't know, everything's dotted or signed, but we will be going to LaPorte Hospital, the old LaPorte Hospital, for 4 months. We have a lease, a no-cost lease there that they're letting us use that space to move our clinic into there. So hopefully our numbers will stay the same. We still have anywhere from 400 to our highest day was 598 vaccinations in one day.
Wow.
Having to be in that downtown area we're hoping to get more foot traffic and obviously public transportation. So hopefully those numbers will stay the same and continue to go up. We have a mobile clinic that is also coming very, very soon. We were able to partner again with Northwest Health. I didn't get to go RV shopping, which I was hoping to do, but they're going to let us lease that, again, a no-cost lease. Currently, we'll be able to use that 12 hours a week. We are purchasing a vaccine refrigerator, a medical grade refrigerator to put in that unit so we can transport vaccine around the county. We can have wheels and boots on the ground, and we can get to areas of the county that are more rural and are not being served. We can get out to the South County, we can get out to the Rolling Prairie, Union Mills areas and bring vaccine to other parts of the county.
That's outstanding.
Yes.
It really is.
I am
Bringing the
thrilled
vaccine
with
to the
that.
people in more remote areas, that's critical.
Yes. And we hope
Congratulations,
to,
good job.
thank you. And we hope to continue that partnership with Northwest Health, even after, not that COVID is going anywhere or ever going anywhere, we will be dealing with this for the foreseeable future with booster shots, but also partner with taking vaccinations possibly out for school shots or other areas of the county for a day, set up a clinic. I need to talk to you about that a little more. Jenny's probably like, what? I can't remember who I talk to all the time every day some days. Was in March, went to and toured the Junebrook facility, looking at some partnerships with Junebrook, also Healthcare Foundation, to be able to do a lot more in the community and to form or reform and re-merge those partnerships that we had previously, get the family all back together, more or less. I did on Tuesdays, Junebrook does a 10 at Tuesdays. You can find it on their page. They do interviews once a week during this pandemic by Zoom and on Facebook Live. It was supposed to be 10 minutes and we ended up doing a 40-minute interview, talking about the health department, what we do, what we can do, and COVID facts and questions overall. So we got a lot of good feedback on that, and glad I was able to go and do that. Commissioner Matthias did talk about the, I don't really know that we have a name for that group, but Jack Arnett from the Michigan City LaPorte Visitors Bureau reached out to me several months ago. It seems like it's all run together back at the end of February into March about bringing a group of people together who could help reach out and get messages across to the public and getting people, pulling them in about the importance of vaccination. And it has pulled in this great group of people. And Sarah Solutions is donating. They are a marketing group. They run our website also, and donating all of their time and resources, or donating in kind. But Healthcare Foundation, Horizon Bank, Blue Chip, there are a lot of areas that have donated to this project. And today we got to see right before this meeting, we've got to see some of those fruits of their labor. And it's going to be fabulous. I'm very, very excited from what we have seen. Just when we were looking at storyboards, I got excited. And even Peggy Rose and myself, we were both got a little verklempt from it because they touched on so many areas. So I think we're going to see a lot of good come out of that. The Spanish video has already been released. They've had, just in the last couple of days, they've had 1,600 hits on that video. It talks about, we have our own dedicated website. You can go to ourshotlpc.com. That is everything vaccination, everything COVID related you ever wanted to know about LaPorte County. You can go to that webpage. You can see where you can go and get vaccinated in LaPorte County. There is a link on that site to take you to get registered for a shot or vaccination. It's very simple page. It's very easy to use, and there's a dashboard showing us exactly how far we are along in vaccination for the county and where we need to get. And as of today, LaPorte County is fully vaccinated. We're only at 29%, which is better than some counties. And that really is we're a little bit higher than average than the rest of the state. The rest of the state is around 27, 28, so we're just a little bit above. But still, Randy Novak, the president of County Council, was doing some math earlier showing that to get the rest of the county vaccinated at the rate that we are vaccinating right now, which is about all of the entities combined, about 3,000 vaccinations, it will take another 17 weeks to get the county at herd level immunity. So we still have quite a ways to go. And I feel like I just completely rambled through all of that. So if anybody has any questions, please, I'd like to answer any questions that you have at this time.
What number are you estimating? Because I know no one knows herd immunity for LaPorte County.
That's where I'll go into a deep dive on that one. Some are saying anywhere from 75 to 80% immunity. The programs that I have seen and some of the research that I have done, when you add in the variants, because the variants are so much more easily transmittable, that throws that number out of whack. And in some instances, they've shown it having to get almost a herd immunity of 95% to be effective. So as these variants come into play.
Are you counting people that have had COVID and developed their own immunity?
No.
Or are you looking at people that have vaccine immunity?
Vaccine immunity, because even if you've had COVID, you can get COVID again.
Yeah. And no one really knows how long let me rephrase that. No one really knows how long immunity lasts from COVID, getting COVID.
Exactly.
Whereas we have a better idea of the lasting nature of the vaccine products that are out there. So, if you're going to take a chance and think you're immunized, perhaps saying you've had COVID before is not as reliable.
It is not.
Yeah.
Yeah, and I think part of the people not taking a vaccination is like, well, I've already had COVID, I don't need to be vaccinated. Well, you can get COVID again. You can get infected with a variant, and the variants are much more aggressive in causing disease and causing illness in younger people.
Right. The 117 is the one that is really going through our nation right now. That's the UK variant, as I understand it. And as you said, it's more transmissible, and there's more morbidity and mortality, meaning people get sicker and more would likely die from that variant. Whereas they're saying, I believe Moderna is the one, or Pfizer, that they believe confers some protection from B117. Did I understand that correctly?
You did. And it goes back and forth on the different variants. Some vaccines are better with the variant than the other vaccine. So.
Interesting.
Yeah. But we do, in LaPorte County, we do have, we believe the B117, the UK variant, is the widespread variant. That is the big outbreak that is happening in Michigan right now. Obviously, the counties along the Michigan border are seeing a higher number. We also have the California variant within LaPorte County. We have a positive case on that.
Oh boy.
So
it's really a race getting vaccinated before the variants, the mutants, spread.
Correct.
We want to get them under control because the more they reproduce, the more mutants are likely, and that's not a good thing for us.
Correct.
Does anybody else have any questions for Amanda? Amanda, is there anything else you still need to talk about, or?
I'd like to talk just briefly.
Sure.
COVID, obviously, always takes so much time. But
Oh, it's good information. I thank you.
But just to bring back again what the health department does and what we do as public health, especially during this time, we are very much seeing that sometimes we don't see exactly what it is that we do until we have a public health emergency. And obviously the purpose of the health department is to prevent, and our mandate from the state, from the county, is public health is to prevent the transmission of communicable disease. And obviously we can do that in very many different ways. And one is vaccination. Another is food protection. Another that we're able to do is through septic, wastewater protection. But really quickly, our codes, we have so many different codes, and it's written down exactly what it is in the IC code, what is mandated for our department to do and not mandated, and what is funded and not funded, meaning what money we get from the state to run that program or not. And unfortunately, we don't get very much money from the state to run any programs. But we are mandated by the state for vital records, birth and death certificates. Last year we issued, and last year was a low year, but we still issued over 10,000 birth and death certificates. And that's not counting any of the information requested for genealogy purposes, which our records go back to 1882. We have written records which are, if you're a nerd like me and like to look at stuff like that, it's very interesting to see some of those records. But birth registry, affidavit for births, for paternity, we're mandated to be part of a infant mortality review, local child fatality review team, which we are a member of. We are mandated for control of disease through communicable disease control and powers for epidemic control, communicable disease reporting, tuberculosis control, childhood lead poisoning, which we're able to perform childhood lead testing for children between the ages of 6 months and 6 years old, and for pregnant women. We also have a certified lead inspector within the county that's able to go out and do inspections of homes anywhere where those children that are positive with a blood level, typically if it's over 10, but if it's a 5 or above, we will go out and do that inspection. Even if it's under that, if somebody calls and says, I have concerns, my child's blood level is only 1, but I still have concerns, we will go out and do that inspection and do the testing. We are mandated to do the railroad camp cars inspections, which they seem to come every other year, which again, I think I've talked about that before, about that being a very special kind of funk, to go in and do that inspections after they have been out working in the sun all day and being those little tiny camp cars. And then we're also mandated to do meth labs. I'm just going to say meth labs instead of trying to say the whole thing. Public records, public meetings, Virginia Graham Baker Pool Act, pollution control when it comes to wastewater. And we've taken that, LaPorte County has really taken a lead on that, especially with our property transfer program, where I've not done the numbers for 2020 or even into this year, but into 2019, we had prevented over 4.5 million gallons of untreated sewage going into our waste, going into our drinking waters and our surface waters for the state of Indiana. we're mandated to do dwellings unfit for human habitation, which those numbers, those inspections have had a little bit of an uptick. Food protection, we have close to 700 establishments that we inspect in the county up to 4 times a year, on top of all of the temporary food inspections. So just let you know, just briefly, some of the other things that we're doing, all of this on top of COVID. Not by any means is it a complaint, but just to let you know that there's so many things going on within the department. And if you haven't been to the department, I invite you to please come in and visit with us and see us. Everybody's always asking, I talk about people all the time about the board, and they're like, who's that? So I'd like for you all to meet our team, to meet our inspectors, and everybody can put a name to a face and have a brief conversation and have a tour of our facility, of our laboratory that we spent. I think several of you were able to tour the laboratory after it was remodeled, but we're only one of 3 health departments that have a drinking water laboratory and surface water laboratory in the state. So with that, I will let somebody else have an opportunity to speak. So thank you.
Thank you, Amanda. Does anybody have a question for Amanda? If not, I'll entertain a motion to accept her report. Do I hear a motion?
So moved.
Okay, is there a second?
I'll second.
Thank you, Dr. Nelson. All in favor?
Aye.
Anyone opposed? The ayes have it, the report is accepted, and thank you again to the entire health department for all of your hard work. It's pretty incredible. All right, the Environmental Health Food Director report.
Hello.
Hi, welcome.
Yeah, I'm Patricia Wozniak. I'm the new person. Well, you could say the new person. I've been here for 31 years, but I've only been in the supervisor position for about a month. So, just very briefly, I still am the person who opens all the new establishments. That's not going to go back to another inspector. I'm going to keep doing that myself. We only opened 7 new establishments in the first quarter. It's been very slow. Not too many people want to open an establishment with COVID happening and all the regulations, so there's only been 7. We have not been putting people on probation. If they have had a bad inspection, we have just been spot checking those establishments instead of putting them on probation, just because the stress level is very high with COVID and all the operators are very stressed out about the whole situation. So if we do have a bad inspection, we just go back and spot check those and make sure they've corrected those instead of a formal probation period. We have resumed the probationary period as of April 1st. So we are putting them back on probation now that things are, well, we thought they were getting better, but maybe not. We did also waive all the late fees for permits that were not paid by December 31st. Those were all waived. That decision was made by Tony before he left, so there were no late fees that were paid this year. We do have well, it's not new, but we have a database that's in progress of doing all our pools and the body art that is being built at this time, so we're glad that's going to happen, and hopefully it'll be something we can really use. The complaints are increasing. We've had quite a few complaints lately. A lot of open burning, trash and garbage complaints. But we get COVID complaints on a daily basis. sometimes 5 to 10 a day. People have no hesitation to call in and tell us who's masking, who's not masking, and then phone calls are made to try to encourage people to mask and wear it properly. That's all I have.
If not, is there a motion to accept the Environmental Health Food Director's report? Do I hear a motion?
Also move.
I'll second that.
Second?
I'll second that.
Second.
Thank you. All in favor?
Aye.
Aye.
Anyone opposed? All right, the ayes have it. The report is accepted. Nurse Jennifer Smith, Nursing Director, report.
Good afternoon.
Good afternoon.
We have resumed all of our public health nursing programs on top of the COVID response, so we are happy about that. We have been assisting the COVID vaccination site with some behind the scenes work. We have been assisting with some scheduling when people have difficulty. We've been collecting patient information for waiting lists, receiving and storing vaccine, ordering additional supplies, trying to procure supplies that are in short supply from our manufacturers and our distributors. Fielding a large amount of phone calls, as Trish said, from the public who need reliable information about COVID. Troubleshooting, scheduling issues they may be having, taking questions and providing guidance for businesses and individuals about isolation and quarantine, because cases are increasing, so the need for isolation and quarantine is increasing, and some people really don't know much about that, so they reach out to us, which we're happy about because we do provide the information to them that's reliable and directly from the CDC and the state. We are still supporting the schools with a part-time nurse, Erica. She's kind of like a navigator for them, assisting them with isolation and quarantine recommendations, contact tracing, approving athletic events and mass gatherings. And she also is doing some plan approving for the public for mass gatherings. We've resumed our safe sleep education classes. We're really trying to push that program hard. Because of COVID, we feel that maybe we need to reach out to the population that is coming to us anyway for immunizations. So our nurse, our maternal child health nurse, Mariah, we are offering the safe sleep education to parents when they come in for immunizations if they meet the guidelines. So if they're 36 weeks pregnant up until the child's first birthday, they are eligible. If they don't choose to participate that day, we do give them written flyers that promote the car seat and the crib program, and they can call and come back another day. Mariah is also still doing the contact tracing for all positive county employees who test positive, and this is done to identify close contacts and to prevent the spread of COVID through our county buildings to keep services going. We did resume our blood profile clinic in March, and also our confidential services clinic. We started that last week. Because our nurse practitioner is the provider for our confidential services clinic, we have to work the schedule around her COVID coordinator schedule, so we are able to offer that opposite of blood profile twice a month for 4 hours. So we're happy about that, even though it's not back full time. At least we can offer the service on a part-time basis. I'm going to talk a little bit about the numbers. So as of today, we've had 11,172 COVID cases in the public, 295 at the Westville Correctional, and 52 at the Indiana State Prison, for a total of 11,519 cases, and we're holding steady at 206 deaths. That has not moved for a couple of weeks, so we're glad about that. And we have had 8 breakthrough cases. reported to us. The state tracks those. So a breakthrough case is considered a positive case that happens 14 days or more after a vaccination series. There have been no hospitalizations or deaths in those 8 cases. 2 of them did visit the emergency department. All of them were vaccinated. 5 with Pfizer, 2 with Moderna, and 1 with Johnson & Johnson. We've also, as Amanda talked about the variant cases, we've had 12 of those reported. 11 of them are the B117, the UK strain, and 1 of them is the B1429 California strain. 10 of those were not vaccinated. 10 of those variant cases were not vaccinated. 2 of them were. However, 1 of them was vaccinated before their illness, and 1 was less than 2 weeks before their illness. 1 was a family cluster of 2, and there were no hospitalizations or deaths in the variant cases. In the first quarter, our programs were kind of slow compared to pre-COVID, but we saw 294 clients for immunizations. Blood profile, we saw 31. We performed 98 TB tests. We did have 3 clients at our confidential services clinic last week, so they are starting to come back to that. We did perform 7 lead tests, and the lead nurse Julie followed up on 2 elevated lead levels from the outside. And we also provided 7 safe sleep classes and distributed 7 cribs to the public. And I can say today, we've had 28 COVID cases reported as of noon. So tomorrow's probably going to be a bigger reported day. So it's not slowing down. And that's all I have, unless anyone has questions.
Jennifer, Nurse Smith, I have a question for you. I always have a question.
It's fine.
I know you guys don't have enough to do, so I thought I'd bring this up, and maybe it was said and I missed it. Are you guys going to resume flu vaccines?
In the fall? In the fall, yes.
So on top of COVID vaccine, there's going to be another clinic, then you'll have to get up and running.
Well, we do that every fall, so we'll have to. So,
but you have COVID now.
Yeah, we had COVID last fall too, and we still managed. We had 3 clinics for flu, so we even added an additional one on from our normal.
Thank you.
So yes, we're definitely going to do that.
Yeah, thank you.
You're welcome.
Does anybody have any questions for Jennifer Smith? All right. If not, I'll entertain a motion to accept her report. Is there a motion?
So moved.
Is there a second? Lord Arnold, thank you. All in favor?
Aye.
Anyone opposed? The ayes have it. The nursing director report is accepted. Next, emergency preparedness coordinator.
I don't see her on. Do you see her on, Amanda?
I can't. Amanda, are you there? Somewhere?
I don't see her on. She had planned on attending, so I'm hoping everything is okay, but I can give a brief update about what's going on, again, statewide and number-wise with COVID. Danielle is, man, she's got a lot of irons in the fire herself.
Does she ever, I don't have a written report from her. Do we have one? I have a big packet of last meeting, because if she's provided us with a report, we could move to accept it. And we could all read it on our own.
No, she didn't provide.
Jules?
No, she did not provide a written report, Doctor. I believe she has been so overwhelmed. I can't imagine that she even had
That's
a moment.
fine. I was trying to streamline it if we had the report.
Right, yeah.
Is
But
there
thank
anything
you.
that comes to mind, Amanda, or should we just...
Just that those numbers at 22,000 are our view. She's been working on that. Been working with the state to get more so we can have more on the mobile clinic. She's currently working on a new plan to get the hospital. We have to submit a plan to the state for us to be able to move our clinic to the hospital, and they have to approve that written plan that also requires a map be drawn out to showing the flow where the
Yeah.
chairs are all gonna be set up, it's kinda crazy the way it has to be written out. And then they will also have to come through, once we're up and running, come through and do a walkthrough of our clinic to sign off on it or not. We will
So
be
she's
getting.
busy.
Yeah, she is a little bit busy, and I apologize. I'll see if I'm not sure why she wasn't on. She had planned on
That's-
being on, but
Real life.
Yeah.
So as it is, we could accept the report as we know it. If anybody has any questions, we can entertain them. If not, let's make a motion to accept the report as stated. If there's any additional information, I'm sure in her spare time she could write it up as a summary, but is that okay with you, Amanda? We have a pretty good handle on it. Yeah. All right. Is there a motion to accept the emergency preparedness coordinator report as stated? Anyone make a motion?
So moved.
All right. Thank you, Dr. Nelson. Good to see you. Is there a second?
I'll second that.
All right. All in favor?
Aye.
Aye. Any nays? Okay, the ayes have it. Next, Attorney Picardo, do you have anything for us today, sir?
Just briefly, again, thank you for allowing us to continue to represent you all. We're happy to do so, and we're going to continue working with the department and each and every one of you to make everything successful. So again, thank you for the vote and confidence for that. I'm happy to report that we don't have any pending legal issues, obviously, with the health department. I did want to bring to the attention to the board some interesting cases going on around the state. And one of those that involves mask mandates and the health departments is out of Wells County, Indiana, and the name of the restaurant that brought a suit against that county is Yergie's State Road Barbecue in Bluffton, Indiana. And that's an interesting case because, they're alleging that some of these orders and restrictions and, mandates to wear masks while, in a restaurant that they're unconstitutional. So we've been kind of tracking that and following it just to be prepared if anything like that happens here in our area. But if anyone's interested in that, we can share some of the complaints and the answers with you all if you want some more details about that. But basically, the restaurant is alleging that the governor's executive order was unconstitutional and that it caused unjust injury. And obviously, the health department there in Wells County is taking the opposite position, that they are, in fact, able to do that and require the public to do that. It's an interesting case, and I think it's not only about masks. It also, has some issues regarding agency and the definition regarding that. So we're trying to keep track of all that so that we're on top of it, to make sure that we're properly representing each and every one of you and the health department as well.
I know you guys have been. Go ahead. Sorry.
Yeah, that's all I have, Doctor. If anyone has any questions or wants me to look, I do so.
I do, as a matter of fact.
Sure.
And first of all, thank you. I know you guys have been very up to date and helping Dr. Ducey as the regulations from downstate change. Then they have to be written, and so thank you, because you guys have been continuously on the ball with that issue. My question is a little bit of like a novice from reading the paper. Something is going on that I'll try to describe it real briefly. I understand the Indiana legislature wants to have the power to make emergency decisions for health department type issues, and not the governor. The governor vetoed that, and they vetoed the veto. That's kind of how I understand my civics here. My question to you really is, I may be ballparking and near target on it. My question is, we've been following downstate and the governor's mandates and regulations and advisories. Is that going to change? I mean, the governor is not going to be able to send us directives anymore? That's the question.
Yeah, I don't think so, Doctor. I think that we're still going to be receiving that, and there are specific rules and local rules that we can take into consideration on making abatement orders and things like that. But I think we're still going to continue receiving direction from downstate and the Indiana State Department of Health as well. And what's interesting too is the Indiana State Department of Health has reached out to our office, and I think also maybe Amanda might have been on that email. They're wanting to provide continuing legal education courses that address some of these issues so that everyone's up to date regarding what's going on. And we were given the opportunity to ask for specific topics that we would like to see addressed. So we listed some that we would like to hear from them. But to answer, and I think we're still going to receive directives as, now regarding whether or not anyone challenges those, that's a question to be seen. But again, that's why we're following some other cases around the state to see how the courts rule. But I still foresee we're going to receive some directives from the governor and from Indiana State Department of Health.
Yeah, because that's been the umbrella under which we all functioned. It supersedes, then we kind of tailor it to our community and our numbers.
Yeah.
And so thank you for that, and Dr. Ducey too, because it's like every other week it seems like we have to change these directives. Dr. Ducey is in her window, I see her, and she's like, yeah. All right, thank you so much.
Yeah, no problem. If anyone has any questions or again would like me to look into anything specifically, just shoot me an email or give me a call. Happy to help.
Thank you. Are there any questions? If not, do I hear a motion to accept the attorney report? Anyone? Okay, that's like a motion and a second. So we're going to move on. All in favor?
Aye.
Anyone opposed? The ayes have it. The attorney report is accepted. Any old business that we need to tie up at this point? I don't have anything. Amanda, do you have anything? Anyone? If not, I make a motion to move away from old business and let's go on to new business. Is there any new business? Anyone? If not, then we're about ready to adjourn, and the only thing left to do is pick a date for our next meeting. But I want to make sure I didn't rush anybody. Is there anything else anybody needs to discuss? If not, let's pick a date.
Dr. Uhas?
Yes.
I didn't mention it during public comment, but I did go out to the fairgrounds and received both doses of my vaccine. And I just wanted to thank everybody who's involved. It was so organized. People were so kind. And when you got your injection, they were very informative as to what to expect, what not to expect. The whole thing was very pleasant. And I'll go back to thanking Tony Mancuso because he was still here when we started this COVID. I'd like to thank Amanda, Jennifer Smith, the staff, Dr. Ducey, all the volunteers, and I hope I haven't forgotten anybody, but just thank you so much.
Thank you for the kind words for the health department. I agree. That's all I've heard is praise for the way the vaccine program has been handled. And it's critical, and I've talked to friends across the United States where people were pulling their hair out in the Pacific Northwest because they were over 65 and there was no sight or smell or a hint of a vaccine coming around or being able to sign up. And they were getting really frustrated, as the weeks went by. So by comparison, for a relatively small county, you guys have done a great job. And we thank you as potential, people at risk for COVID. We are really grateful. Is there anything else anybody else would like to say? Otherwise,
Can I just make a comment?
Yes, Doctor.
Just one thing, that case that you're talking about whether they're going to try and overrule what the county health people make decisions as, we're still right now on a month-by-month mask mandate. And that will come up again, I believe, at the beginning of May. So that's something else that I've been watching that too. I get a lot of information about that. And of course, our concerns is that even if we do have a mask mandate, will somehow be overturned. And now it was a little reassuring to hear that perhaps it's not going as far as I thought it might from some of the information that I've got. But that is something that at this stage, if we stay in orange, we will continue to have a mask mandate.
Yeah. Yeah, there was
support of the board for that type of thing too.
Yeah, we follow your guidance and the law firm's guidance so that we know we're on good footing. We don't just throw a dart at a board and say, oh, this is what we're going to do. But we have to feel comfortable that we're getting the best advice, and we do. The other thing that I want to mention, Dr. Ducey, is Mayor Dormady had a really good thing a couple of weeks ago where he met with mayor from Michigan City, other people involved in government. You were there. I went to listen like a fly on the wall because you were that star of the show and you did a great job. And what happened is everybody that was there, both mayors, other council people, commission people, everybody agreed to renew the mask mandate. Do you think they're going to do that again? Because that gave us a lot of leverage and credibility. And do you know, have you heard anything? I thought that was a
I have. I mean, we still, right now, if all of a sudden we drop back into blue, I guess we have to rethink it. So we've still got another almost 2 weeks and a bit before we have to make that decision. But for me, it's going to be totally based on where we are in terms of colors. Yeah, that's the big thing.
Yeah, follow the science.
Right.
All right, great. Anybody else have any comments or questions? If not, we have to pick a date in July. I'm going to throw out the 13th of July. Does anybody have a conflict with that, or could we?
That's Fair Week.
Is that Fair Week?
Yes, that's Fair Week.
People are all busy that week, all our employees?
I don't know.
Well, we will be out of the fairgrounds every day doing inspections. I mean, we can have a meeting, but I was just letting you know that was Fair Week.
What's a good week that's not Fair Week? In July. What week are you guys free?
Are you still looking at a Tuesday?
Yes, ma'am.
We have the July 20th and then the 27th are Tuesdays in July.
Yeah, how's the 27th sound?
It's fine.
That's good with us.
Everybody, Dr. Nelson, you good with that?
I think I'm on call. My mute, you can hear me, right? I think I'm on call that
Yeah.
Double checking there.
All right.
I'm free on the 20th. I mean, I can still make it I just become a maybe when I'm on call.
Yeah, the 20th, these guys are tied up with the county fair.
No, the 13th we are. We're available the 20th. It's the 13th we have the fair.
Oh, I'm sorry, the 13th, yeah. 13th is the fair. Let me write that. So.
The 20th I can do.
The 20th, all right. Anybody else, the 20th is open?
I can't do it on the 20th in terms of being here, but as long as it's Zoom, I'm just going to be in Chicago that day, so I can, as long as I get the Zoom information, I'm fine.
Okay, you could get the Zoom info.
Yeah, exactly.
What about the 27th?
Like I said, I'm on call. I can probably still do it Zoom.
Oh, I'm sorry, you're on call the 20th. You gotta get the fair, all right, so.
My computer at the hospital and do it there, so that's not a major problem.
Okay, all right, that's fair. So, Dr. Ducey, you're good with the 27th?
I'm good with the 27th, but like I said, I can Zoom from where I am, so whatever works for everybody, it doesn't matter.
All right, let me just go across. Mrs. Arnold, how about you?
I can make either date, I believe.
Okay, and let me get the list here. Dr. Dora, how are you doing with that 27th of July?
Yeah, that date's fine for me.
All right. Dr. Cox, how about you?
That's fine with me.
All right, so from unless I missed someone. Oh, Ellie, how about you?
I'm flexible either way.
All right. Well, unless somebody has some conflict, in which case speak up right now, we'll book it for July 27th at 4 p.m.
Okay.
Good.
All right. Do I hear a motion to adjourn?
So moved.
Is there a second, or did everybody already leave?
No.
Oh, yeah, come back, you guys. All right, so Dr. Cox, second. Yes. All in favor?
Aye.
All right, and anybody opposed and want to stay long? No? All right, the ayes have it. The meeting is adjourned. Thank you, everybody.
Thank
Stay safe,
you.
stay healthy. God
Good
bless.
night.